Well, without any further ado, let's start. So I'll, like I say, I'll begin with sort of 5 minutes intro, because I think we've got quite a few questions today to get through. So without further ado, welcome everybody. Thanks for joining. Please remember this is being recorded so people can access it later, but to use this as a sort of cascade down, because there's quite a bit of stuff going on at the moment. We're in day 3 of the first part of lockdown. I'm sure everyone's been to the pub, the gym, and had their hair cut, or will be in train soon. Lots of implications for the organisation as we move forward and start to think about, okay, what's it going to look like? Just to rehearse a couple of the principles, because they're really important. The most important thing is that we continue to support our staff in all their endeavours, both in terms of getting back to what's, I guess, best called business as usual, but describing what the interim arrangements are going to be. I know there's a question later about homework and making sure we get the balance to enable people to continue to do that, but at the same time remain connected to their teams and the organisation. The other thing that we need to talk a little bit about is staying safe, as one of the inevitable consequences of lockdown will be the risks around social contact. And then thirdly, just to be starting to think about, okay, so what are all the things, the threads of the stuff that we need to pick up that we might not have been so focused on. So there's a whole infrastructure around the strategic planning, the annual plan, the money, the efficiencies, the performance management that over the coming months will start to fall back into place. So as ever, a big thank you to everybody for what they're doing. The trust continues to be in a good place in terms of where we are for our patient service users and carers, and we continue to be in a good place in terms of staff access to vaccinations, managing the outbreaks, and continuing to provide the services that we need to provide. Just a couple of bits on vaccination. So it's really important that we continue to encourage all our staff to avail themselves of vaccination. I think I've got just over 1,500 staff who are yet to be vaccinated, and that includes bank staff too. You may be thinking, oh, have I missed the cohort for health and social care? It's one of the earlier 2A or 2B cohorts, I think, but there hasn't. So no is the answer to that. There is still plenty of opportunities to get your first dose if you've not had one, and to encourage your colleagues and your peers too. We appreciate there's hesitancy, there's questions, there's uncertainties, and that's perhaps been underlined by some of the recent data coming out, particularly in relation to the AstraZeneca Oxford vaccine. There are alternatives. There's lots of good evidence now to support the importance of getting it done. So that continues to be our position. Please, wherever possible, get your jab. And in relation to that and the what I was saying a few minutes ago about lockdown easing, there will inevitably be an increase in cases of COVID as a consequence of increased social mixing, and that's been put into all the sort of grand stats forecasting. But the critical thing will be that hopefully, as that happens, the rates of severe illness and the rates of death will not increase, and that's why the government's got this stepwise programme of relaxation. And the really important message, if there's one thing to take home from today, is the importance of continuing to follow the guidance around social distancing, lateral flow testing, and use of PPE. I know I say it every time, and you're probably fed up to the back teeth of me banging on about it and going out in the comms, but it's critically important that we continue to do that. Let's not drop our guard now. Overall, the number of outbreaks is reduced significantly. I think we're down to 3 or 4 now, so that's come down from the sort of low teens. So that's brilliant. But let's keep really tight on it. The one specific thing related to this is that we're really low in terms of our reporting of our lateral flow test results. So look out for this in various communications messaging through the next week, because we are getting increasingly tightly managed on it, both from region and from the infection prevention and control teams, and that they will come back and start to impose themselves on us as if we don't make it easier and keep reminding staff the importance of doing lateral flow a couple of times a week. And we're going to restating the process around what the requirements are to do that. But please keep testing and please get the results uploaded. It's really important that people can continue to do that. So thank you in advance for your cooperation with that. I think probably Yolanda, that's as much as I want to say by ways of introduction, because I know we have got quite a few questions to get through. I don't know if you're completely and properly plugged in to be able to start to divvy those up. So over to you, hopefully.
Well, we're about to find out whether it's all working fine for me, John. And if not, I've got Jenny as my wingman, who's happy to pick up if I lose connectivity or anything. I think my computer did a forced reboot at exactly the wrong time, so apologies everybody for that. The first question, Lorraine, is for you, really. It's about the lease car scheme and if the scheme is planning to be changed in the future.
Thanks, Yolanda. So I'm aware, so I'm Lorraine. I should introduce myself first. I'm Lorraine, the Director of Finance, Information and Estates. So I'm aware that the lease car scheme is something that has been challenging through COVID because of the changes to working arrangements for many. So we're aware it is something that needs to be reviewed, particularly as we emerge from COVID and come back to business as usual and understand the implications for individual teams and their work basis. So that is something that will be reviewed as part of that. In the intervening period, if there is any individual who is worse off at this point and is suffering hardship because of COVID and the way their role has changed, we have got some arrangements in place to consider that on a case-by-case basis. So for that individual, Yolanda, we'll make personal contact with that individual and we'll make sure that we pick that up as well. But more generally, yes, the lease cost scheme does need to be reviewed alongside all of our returning to business as usual processes over the next few months.
Thank you, Lorraine. Very comprehensive answer. One of the questions, I think this might be for you, John, and it was specifically asked about admin and secretarial staff, but I think it's relevant to quite a few staff anyway. They're asking whether there's going to be any provision going forward for staff to be able to continue with a degree of working from home.
Yeah, thanks, Yolanda. Yeah, it's a good question, and the very short answer is yes. The senior leadership team are working through some of the implications of that over the next week or so. And as I've said previously, I think it's really important that we get the balance right on this. So there have been, haven't there, many lessons to learn from the pandemic, and the ability of the MS Teams, for example, and related things to facilitate people working from home and not having to come to office spaces all the time is one of the real benefits. And we need to capture that and the good bits of it, don't we? We need to make sure that we support people to work at home where it's sensible and feasible to do so. As I mentioned right in the introduction, one of the things that people really enjoy about their work is being part of a team, and we need to enable that to happen too. So it doesn't just become either you're working at home or you're working in an office, and it's going to take a bit of sorting out the logistics of how that would work and how it will happen, and it'll be different levels of coming into sites for different teams and different professional groups, and depending on what sorts of services people and teams are providing. And that all needs to be worked through. There are some really mundane and boring things. Well, perhaps they're not that boring, but it's like, for example, if you've got a team working at home that collectively manage phones, we need to make sure that there's, just the technical bits about covering phone rotors, certain public-facing parts of our services, things like the postal delivery rotors and things like that. That it's easy to forget about. You get a stack of posts stacking up because no one's been in the office. So there's lots of detail to work through, but the principle is that there's an awful lot of benefit from not having 9,000 people or thereabouts on the road at 8 o'clock coming in during rush hour. Lots of things that we need to capture and bake into where we go from here. So that hopefully gives some sort of flavour of what we'll be expecting the output of that to be.
Great, thank you, John, for that. Then there's a question about shielding and annual leave. So somebody's asking whether those that have been shielding are allowed to carry annual leave over. Are you happy to take that one, John?
If we haven't got a specialist person that knows what they're talking about with regard to HR advice, then I suppose it will be me.
Well, that means
So
it's you, John.
We have got provision to, again, given that we're in unprecedented times, for people to carry leave over. But again, just to go back a couple of steps, it's really important that people continue to take their leave. We know that lots of staff have worked over and above right across the organisation, and have really helped keep us on track, and are tired, and it's really important as part of people's overall well-being to take the leave when they can. But we appreciate in some circumstances that hasn't been possible, and we've put a facility in for people to be able to carry it over from last financial year into this financial year. In terms of the specific with regard to shielding, I wouldn't like to say on this call exactly what the rules are, but I would think, I can't think of any reason why we wouldn't be able to carry over as with anybody else. But if we could come back to be more specific on that. Sorry, it's a bit vague, but I would think yes.
Okay. On the subject of annual leave, John, I just wanted to add that we've had quite a few comments that people were happy for us to promote about the extra annual leave day that the executive team gave to staff for their efforts throughout COVID. And again, that day was given, just reflecting on what you've said, John, for people to use for their well-being, and so for people to consider how they use that extra day. But we've had some very, very nice comments from staff and team leaders about how much they appreciate being given the additional day of annual leave. So, a big, massive thank you, they've said, to the executive team for that. So that's really, really good. Staff uniform. Becky, I'm just conscious you haven't answered a question. Can I give you the staff uniform one?
You certainly can. I will try my very best.
Okay, well, here we go then. So people are asking whether there will be an opportunity to actually see the uniform so that they can make a decision as to whether they want to wear a tunic or a polo shirt.
Ooh, and I've seen a bit of debate on the Facebook page. So my looking at the answer, there is going to be opportunities. We're looking to see what photographs we can get of the uniform, which I should think we'll go on Connecting Knots. And actually, I think there is some choice in that. There's also an email address that we can post around any queries to do with uniform to a central point. So if anyone's got anything specific, then again, they can pop that into there. And I know that they're being managed through team leaders and managers as well through the divisions. So I think if people have got queries, go to those line managers, but there will be more in terms of photos, pictures. At the moment, I think it's a bit of a it's something on Connecting Knots, so we'll definitely get some of that in real life so that people can see those differences. And obviously it's been promoted quite widely, the different colours for different things. I think the thing to remember is staff have really been involved in this uniform consultation. It may feel that it went a bit quiet, but it's been going on, I'm looking at my colleagues, but far longer than I've been in the organisation, so a good year or plus. So staff have really been involved in doing that, and the idea around the uniforms is around that identity piece, so that if you walk onto a ward, that actually it's very visible what people in different uniforms are. And Yolanda's put the email address in if anyone's got any further specific queries. Thank you.
Okay, thanks very much for that, Becky. And Lorraine has put some specialist advice from HR, so we don't have to make do with the generalist information that John gave us. That there is provision to carry over 5 days, and in the event of there being exceptional circumstances, a further 5 days can be agreed by line managers. So thank you for that, Lorraine, and the HR specialist that gave us the insider knowledge there on that. There's a question here that I'm going to answer myself, if that's all right. It's about the Oscars. Someone's asked if the Oscars has closed for nominations. Yes, it has, and we are absolutely thrilled that we have received a total of 434 nominations. So this is the most nominations we have ever received in the Oscars. So thank you to everybody out there who's voted for their colleagues and put those nominations in. The judging is now underway, and we'll be announcing the shortlist on Connect in a few weeks' time, in May. Right, so just flicking through the questions. Becky, are you in the hot seat for taking the one about visors as well? Well, you are now.
I'll find my mute switch quick enough. I can give it a go. I'm clearly okay. Yeah. So
so staff are asking when they'll be able to stop wearing visors. They've mentioned about staff supporting patients on acute sites. And that their staff aren't wearing visors, but our staff are still wearing them. And they're talking about clinical areas. So I think as the most clinical person that's on the group today, Becky, I think that question does fall to you to do your best. And if there's anything that you don't know or anything we need to refer, we can always put something in the chat later.
So thanks, I think thank you. In relation to that, that I think if people are deemed to be in a red clinical area, then visors do need to still be worn in terms of the sort of specific for that question. There's quite a nice roadmap that, again, we'll try and put in the chat, which looks quite nice in terms of the different dates in relation to IPC roadmap and guidance around what can be lifted. So we'll pop that in the chat in a second, and people hopefully will be able to pick up from that. In relation, a bit similar to the other one, your heads of nursing and your matrons on the wards should be very clear, be able to give you very clear guidance in terms of that. And my understanding is, I say, definitely in red pathways from the 12th of April, visors do still need to be worn. Jenny's popped it in the post, which is excellent. And in amber and green areas, they only need to be worn if there's a risk to splash or spray to eyes. But I think that roadmap makes it really clear. If I can understand it, then hopefully most people can, in terms of some of that IPC roadmap. I think it's important to pick up on John's point, though, that actually, all IPC and PPE is another line of defence amongst COVID, and that actually we need to, you know, comply to that guidance to keep ourselves and our patients safe. And Penny's popped in the chat that the main change is that amber pathways can now be risk assessed. So the idea that if you fall between those two, it might be really clear if it's a green area, and the amber ones, again, those matrons and team leaders can reassess those areas to decipher where they fit on that IPC roadmap. And I'm sure if Anne-Maria was here, she'd give a much more comprehensive answer than I have, but hopefully that helps. And I think the little map does too.
Great. And Penny's put a comment in the chat as well, that now for the amber pathway, this can now be risk assessed. So that's helpful too. Thanks, Becky. I think you're off the hook now, and I'll turn my attentions to our Chief Executive again. John, we've had a couple more questions for you, if that's all right. So I know that for some people, they are absolutely fed up of hearing about it, but some staff aren't fed up of hearing about it. And so we've had a question from a member of staff about whether we're doing anything as an organisation in remembrance of the Duke of Edinburgh.
Oh yeah, thanks, Yolanda. It's interesting, isn't it, how the variation in responses, and I saw the other day that the BBC had the most complaints ever for some of its programming over the weekend. I think it's important as a public body to recognise the contribution that the Duke of Edinburgh made, you know, over many decades of service. He might not be everybody's cup of tea, but I think it's important to be respectful. We've posted a number of messages of condolence on social media sites, and we've also got where we have flagpoles, and I know we have definitely got them at Rampton and at Duncan McMahon House. We fly in the Union flag at half-mast. We've also been under sort of relatively light touch instruction from the national and regional teams about what we can and can't do in terms of communications and other sorts of stuff in the sort of 8-day period of national mourning that we're in. So hopefully struck the right balance.
Just to add to that, John, the day of the funeral is on Saturday, and there is a 1-minute silence at 3 p.m. So if staff are wanting to take part in that, then they just need to speak to their line managers and make that happen. And likewise for any patients that wish to pay their respects in that way. And then one last question for you, John, is about the in light of the controversial Sewell Commission's report on race and ethnic disparities, alongside our ongoing work at eliminating racism and inequalities, will you, particularly named, and the team be acknowledging the report or releasing any statement in your daily briefing about how it affects our EDI work?
Yeah, thanks. Great question. Thank you. So part of the formal answer is that we can't comment on government responses specifically. However, I think it's really important that, as we have found within our organisation, that well, it's really important that we take equality, race really seriously. I think it's really important that we acknowledge where we still haven't got things right, and hopefully we're in a better place than we were in terms of being able to talk about the challenges that we have. But I'm aware that we've still got a lot of work to do. I'm really pleased with some of the work we're starting to put into place. The BME network have been brilliant in recent times. That I know the numbers joining have increased significantly, and that I think they've been a really strong sort of voice of conscience for the organisation in trying to help us move forward together and to be much more inclusive, where people feel confident about being able to call things out, but also feel confident and able to contribute, that their voice matters and will be taken heed of. So yeah, I think it's a good call. I think it's important to acknowledge some of these important national publications. The organisation, is a part of the broader society. We've still got a lot to learn and things that we can improve on, and we'll be continuing to do that internally as well. So yeah, great question. Thank you. Hope that sort of gives a sort of sense of where I am in my head on it.
Thanks, John. Simbi, our Freedom to Speak Up Guardian, has put a comment in the chat bar on today's call that leave has been something that has been raised with her as the Freedom to Speak Up Guardian, with staff commenting on inconsistencies amongst staff. And the comment that they've been saying to her is that it's not been equitable across the services. I'm not sure whether you want to add anything to that, John, about that's been raised by Simbi.
Yeah, I think it's really important, that people feel able to raise it if it's not right. And I said before that we don't always get it right, but unless we know, we can't do anything about it. And if there has been inconsistencies, we'll try and iron it out. The only point I'd add, and I'm not diminishing individual issues, is that some people don't want to take their leave. It's really important that where you can take it within the financial year that you do. But if there are other issues that there is an inconsistent message coming from us or from managers, yes, we need to look at that.
Okay, there haven't been any more questions come through in the chat, John, so I think if you would just like to sum up and close the Q&A for today, that would be great.
Thanks, Jan. There's a couple of sub-questions around the vaccination stuff. I don't know if you talked about this in your prep. At the bottom of page 3, which I think are probably quite important, because if people are asking these sorts of questions, I'm very able to answer it. So the first one is, does the trust or any of the executive receive any remuneration for each COVID case logged? No. We around the payments, Lorraine may want to add a little bit more, but essentially, since we went into sort of full level 4 command and control pandemic, the income the trust receives on a monthly basis, if you like, is set. And then there are additional payments related to COVID, but they're related to specific things. So what an obvious thing will be, for example, the amount of money it's cost to buy all the PPE. And you can imagine there's a whole list of lines on a spreadsheet that have got cost codes against that we get additional trust income. But I want to be really, really clear that there's been no additional payment made to the executives on this. I don't know, Lorraine, do you want to say any more about the COVID payments that the trust does get, just briefly?
Yeah, so the only thing I would add, so you're absolutely right, the income that we get is very specific, and what I would add is that it's very closely and heavily monitored by our regulators exactly what we do claim for. So they will come back and they will ask questions of us if they feel that there is anything that is inappropriate in there. And John is right, the sort of things we claim for are PPE, the costs of buildings, the costs to staff those buildings and for those that administer the vaccines to give them, but absolutely no payments other than for the cost to deliver the services.
Thanks, Lorraine. There's a related question. Does the trust or any of the executive receive any remuneration for each vaccine administered? No. So the financial underpinning of the vaccine programme is quite complicated, which probably won't surprise many people. But there are significant amounts of income coming into trusts and primary care networks to fund the vaccines, and essentially there's a tariff cost per vaccine provided, and again that goes to fund the various amounts of infrastructure and personnel that are providing the vaccinations. So the personnel is coordinated by the Sherwood Forest HR team with a lot of support from our people, and they've got over 4,000 people booked onto their bank to staff the various hospital hubs, vaccination centres and mass vaccination centre in Mansfield, and there's all those rotas being manned and womaned. So the wage costs are probably the most significant cost of the vaccination programme, and that's what the money goes for. And then the final bit is on this one, Yolanda, was has the trust removed the AZ vaccine from its recommended vaccines after the admission by the Medicines and Healthcare Products Regulation Agency, the MHRA, that it carries a blood clot risk? No, it hasn't. We haven't removed it. Again, we've complied with national guidance from the Joint Commission of Vaccines and Immunisation and the MHRA, which has concluded that although there is a very small risk of blood clot, it's not in terms of the balance of risk versus benefit. It's that people will be very clear the vaccine has not been withdrawn. There are additional recommendations for people under the age of 30, which we will apply, but it's still available. We're still using it and we'll continue to use it until there's a change in national guidance on it. And the feedback from the sites that I've just alluded to are that not by and large, people are still very keen to avail themselves of both vaccines. There's not a mass move from the AZ one to the Pfizer one. And people will have seen the relative risk comparisons in terms of whilst it's a very serious complication, it is incredibly uncommon. But we'll keep a weather eye on it. This is, in some ways, it adds confidence to the fact that the surveillance system for the implementation of new medications is working, both nationally and internationally. There you go, Yolanda. I don't know if there's any other sort of additional bits and questions related to any of that before we go on to sum up.
Jenny's put a question in the chat about, we've just had World Autism Awareness Day on the 2nd of April. I'm just wondering how you have been inspired by working with or knowing people with autism.
Oh, I muted myself there, sorry. What a great question, Jenny. I know what to say. It's always really easy to go into a sort of fairly glib, oh, it's fantastic, blah, blah, blah. But just giving some thought to that question, I think it's, I'm just sort of reflecting on my time working in clinical services over many years where, I know I'm talking a very, very long time ago, last century, but autism was a really niche area with that was not often diagnosed. You didn't see a lot of it in clinical practice, and I always think that, you know, how much of the challenge and difficulty of living with such a complex condition just went through the sort of unmet need and the challenges that individuals and families had to manage with very little support from the NHS, and that how that's changed over the years for it to become a much more recognised or set of conditions, really, not just one thing, and how that NHS and care services are catching up in terms of meeting the really challenging needs of some people that have this this and related conditions. So I think it's a really good example of how the world changes and how we catch up and get into the right place and doing the right things for people. And when I first started and was able to tour around, met a fantastic team based at Highbury Hospital doing some fantastic work in this domain. And I remember I planted a tree. I think they were celebrating their 10th anniversary. So Notts has always had a good reputation in this area, but I just remember coming away with a great feeling of love and compassion for that team and the service users that were visiting that day. So yeah, that's a couple of reflections from me on that. And thanks for raising the question, Jen.
And there's just one sort of question comment from Catherine Thornton about when we're considering changes and updates to our policies following the COVID situation, will the people plan be used to ensure the updates are staff focused? I think we all know the answer to that, John, but answer it anyway, please.
Oh, you're very bossy today, aren't you, Yolanda?
What do you mean today? I thought I was like it every day.
That's true. I was being kind. No, absolutely, Catherine. Really good point. And we are in the throes of reviewing our thousands of policies, procedures, and guidance that have grown like topsy over the years. And I think we're leading some quite positive, engaged work with divisions and directorates about bringing the policies up to date. So there are far less of them, they're much easier to read, and they are focused on what they're there to do, which is helping support staff to do their job and carry out their roles. And we've got some good inputs. I'd like to say that I think we were a bit ahead of the people plan because we started to do that before the people plan was published, but I'll say we're aligned with it. But absolutely, really good point.
Great stuff. I think that's it then, John.
So shall I summarise?
Please.
Well, just to say thank you again to everybody. Thanks for putting all those questions to us. Apologies, we might have been a bit caught on the hop today because of the aforementioned IT glitch at the start, so we weren't perhaps quite as prepared as well, I certainly wasn't, as it could have been, so sorry. But keep the questions coming in. Thank you for everything that everybody's doing. Please cascade this round so that we can get more people engaged in the conversation. And finally, don't forget to report your lateral flow test results. Thank you.
Thanks, John. Thanks, everybody else.
Thanks very much.
Bye.
Bye.
Bye.